Hello and welcome to HW News. Today we will be talking about the second wave of the coronavirus pandemic and how youngsters are going out of their way and helping citizens in need. Before we start, if you're watching this video on Facebook, please like and follow our page. And if you're watching this on YouTube, then please like and subscribe to the channel and share this video with as many people as possible. Let's begin. As the coronavirus pandemic rages on, India is recording its highest caseload ever. On Tuesday, it reported 3.23 lakh cases and close to 2,800 deaths. Since the last month or so, if you have browsed through social media, you must have seen endless SOS calls from all parts of the country. Hospitals have been alerting the government for lack of oxygen. Individuals have been pleading for medical help to improve their worsening conditions, and on many occasions, not being able to get out of the clutches of the virus. All these requests capture the dire and overstretched condition that our country's healthcare system is in. Amidst all the chaos and frantic rush for oxygen cylinders, beds, ventilators, and other medications, social media has emerged as a support for countless citizens. At a time when the governmental machinery has collapsed and hasn't been able to fulfill its responsibilities, the youngsters have taken it upon themselves to help their fellow citizens, whether known friends and relatives or strangers. Actively tweeting or using Instagram for amplifying requests of remdesivir, oxygen for critical patients, arranging hospital beds, and even cooking home cooked food for COVID positive patients, the youth has ensured to unite and come to the rescue of many people. We talked to some of them and try to understand what prompted them to go out of their way and help their fellow citizens.
Because of the scenario and the way it was developing, resources were becoming increasingly scarce, and there was a lot of mass panic that was spreading. So me and a couple of my friends, Prithvi and Aditya, we decided to start off with helping people to get access to the resources that they need. Because in troubling times like these, with a bit of free time on our hands, that's the least we could do to help people out. And we realized that this was an initiative that would help save a lot of lives. That was the need of the hour, so we decided to go ahead.
Ever since the beginning of this COVID, we have started providing food. So like the first wave hit kiya tha, that time also we were providing food to people. But us time pe people did not really need COVID specific food. So it was more like a normal food meal that we were providing. Then eventually, because the cases went down also and then people just not wanted, we had stopped. But right now when we ourselves were hit with COVID, we realized the importance of nutritious food for the COVID patient, because even after you fight with COVID and you come back normal, there's a lot of weakness in your body which can be helped only and only through good nutrition during the period that you have COVID. So I just felt like the world is going through something so difficult right now, and being a COVID survivor, I felt ki the kind of nutritious food that my mom gave me is what is, has reduced the weakness that I have right now and everything. So, I mean, this is the least I can do to help people around me right now. So providing food was the most, easiest and helpful way I could, contribute to the society.
The road to this humanitarian endeavor hasn't been an easy one though. Fake resource kits and helpline numbers, no response on the leads mentioned, or in case of a response, getting to know that the required help can't be given due to exhaustion of resources are some of the many issues that the youngsters have to face.
So chaotic, and not just that, another huge obstacle in this entire helping system is getting authentic contact numbers. There are many contact numbers out there, but trust me, only 10% of them are genuine. The other 90% either don't pick up or the number is wrong.
The biggest challenge right now is actually the fact that there are so many fake resources going around. So it's very difficult for, genuine resources to be found by people who actually need them. And I came across people who, even faked having COVID just to receive these meals at, cheap rates and everything, which I feel is just ethically wrong, because being a service provider right now, even I am doing my best to provide something. So, if people who are going to do that, like are going to behave that way with me, it's just demotivating for me to work ahead as well. And yes, gathering the resources for making the meals has been very, very difficult. But so we have like the specific vendor that we take the vegetables and everything from. So we've told him that we're providing meals for COVID patients. So he keeps aside these specific vegetables that we need for us. So collection of the resources hasn't been that much of an issue, but yeah, I mean, spreading the word that yes, we are doing something like this for the good of the society has been more difficult.
So it was my uncle. He was diagnosed with COVID around a week ago, and he was in a very critical condition. His CT scan came out to be around 16 or 18 and 25, and he was immediately admitted into the ICU. So we were searching for the bed, and you know what the scenario is right now in Delhi. He stays in Delhi, so we were quite frantically searching for a bed in Delhi, but we weren't able to find anything. But luckily, we've got one bed near to his home, near in a nursing home. So he was admitted over there in the ICU, and then the doctors ran a couple of tests on him, and they told him that he was in a very serious critical condition, and we would immediately require the injections, the remdesivir injections for his treatment. And all of our family members, or my entire family, they panicked because this was the first serious case in our family. So we never had the experience of how to to this experience before to search for the medicines and the injections. So we all panicked, and we all were searching for the injections, and we all knew how hard it was going to be to search for these injections and these medicines.
The icing on the cake, of course, being when these desperate appeals bear fruit and the needy get the desired help, cutting across cities. Needless to say, this comes as a relief to both the person helping and the beneficiary who has received the help.
So I also texted Manav at that time, and he connected me to his group of friends. And I think around 3:30 p.m. that day, he sent me a contact of a man who not only gave me 6 doses of those injections, he also gave me at the MRP price, because at that time, even now, right now, we all know how severe the shortage is right now for those injections and the vaccines and the medicine. So to get them at the MRP when all of them are selling at black price, it was quite a good thing for us, because we couldn't have afforded the black market price. So we got the 6 doses of injection at 3:30 p.m. at that same day. So still he's not stable right now. The injections are mm, not working that fine that as they should have, but the doctors are still making the efforts, and we all hope that everything will get better soon.
Amongst all of this, there's also severe angst among youngsters against the political class, which seems to have prioritized election rallies and engaged in the usual political slugfest to avoid addressing the crux of the situation.
This current situation and the way the government leaders are leading it, it's plain sad, because I mean, there's so much so many deaths happening, and still all they're bothered about are the elections. I mean, yes, it's important for you to get elected, no one's denying that, but I mean, it's basic humanitarian traits for them to keep that aside, and first help the country as a whole, because the country is not just West Bengal but the entire of India. And it's just plain sad how they're behaving. I mean, when I used to see the rallies on news, no one even questioned the people in the rally if they were wearing masks or not wearing masks. Our prime minister was giving speeches without wearing masks. उनके सामने लोग खड़े हैं बिना मास्क पहने, and he was least bothered. I mean, it's nothing more than sad, because I mean, they're urging the youth to come up and do it, but it's honestly not our responsibility alone. So I mean, that's all I got to say.
Firstly, I'd like to start off by saying that I had a conversation with a couple of doctors working at the forefront recently, and they said that there was no way that anyone could have been prepared for something like this. That being said, the rallies that have been going on, as well as the gatherings that have been going on the name of politics, are something that aren't really necessary in this scenario and should have been curbed. And I think that would be my most important message, that if it's not required, then just for the sake of, say, election rallies or votes, it's something that we can skip as of now, because that's definitely a huge breeding ground for the virus. And beyond that, a more active methodology of helping to get out of this by at least reassuring citizens with some proper statistics and facts would make a lot of sense as compared to just stating that this is how we will get past it without having any solid base for those arguments.
Amongst all of this, there is also severe angst amongst youngsters against the political class, which seems to have prioritized election rallies and engaged in the usual political slugfest to avoid addressing the crux of the situation. One can only hope that many more youngsters come forward, bend the COVID curve favorably, and start holding public representatives responsible at every juncture. Tell us what you think about this move in the comment section below. Thanks for watching.
Hello everyone. HW News English is 2 years old now. When we started this venture, we promised ourselves one thing, that news should remain free, because right to know is the right of every Indian. But to keep news free for everyone, we need support from some of you. And thus we have rolled out membership on our YouTube channel HW News English. But mind you, the membership is completely voluntary. The programs that we were doing earlier, that we are doing now, will continue to remain free. First level is a basic level. Here, you can be our supporter by paying Rs 199 per month. This membership gives you certain perks and benefits. The perks include unique badges in front of your name, a live show from Mr. Sujit Nair and from Mr. Akhilesh Bhargava per month for our members. You can also vote in some exclusive members-only polls. Now the second level is Super Supporter. Here you can be our Super Supporter by paying Rs 3,999 per month. This membership will include every perk that comes with basic level. Additionally, our Super Supporters can be a part of a WhatsApp group where we can have discussions and suggestions on various topics. The second perk includes a gift pack with our merchandise. And the third perk is a Google Meet with Mr. Sujit Nair, where you can join the meet and ask your questions to Mr. Nair face to face. Lastly, if you like, we would give a shout out to our super supporters in our programs. So, hope to see you soon with our badges.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.